Hello, doctor. I'm Miliana, and I want to ask you some questions about hypertension.
Pleasure to meet you.
So the first question is, what caused the disease?
Well, the disease, it's a multifactorial disease. There are some genetical factors as well as ambiental factors like diet and health, but genetic factors also play a major role in the hypertension disease.
How serious is it, and how does it affect the patient's lifestyle?
Well, hypertension can be a serious disease. It depends on what stage it is diagnosed, and basically it affects in the patient's lifestyle that you have to live a healthy lifestyle as part of the treatment. So basically, hypertension does affect all the parts of your lifestyle. You have to eat healthy, you have to do exercise, so it does affect your lifestyle.
Okay. What is the short-term and long-term prognosis for this disease?
Well, the short-term and long-term prognosis is a very good one if it's treated, if it's well treated. If you leave the disease by itself, the long-term prognosis is a bad one. You'll start to lose your eyesight, liver and kidney disease, and many other vascular diseases. But if you treat it well, the long-term and short prognosis should be good.
Okay. What was the chief complaint that the patient had for consulting?
Well, most of the time, it's asymptomatic. It's like a finding in a regular checkup. That's why it is called the silent assassin. But when the disease is advanced, you'll probably feel headaches, shortness of breath, spots in your eyesight, but most of the time it's a silent disease, asymptomatic.
Okay. What other symptoms does the patient present?
Well, many open their disease or start with their disease in the initial symptoms like cerebral vascular disease, like hemorrhages in cerebral areas or myocardial infractions.
Okay. How can the patient be tested for the disease, and what do these tests reveal?
Well, this is a very easy diagnosis. People in their regular checkups should have their pressure measured, and that would be the diagnosis. It's a very easy diagnosis to make.
What are the treatment options?
Taking as a fact that ambiental factors play a role, like obesity or sedentarism, well, the first step in treatment is to eat healthy, to exercise, to lose weight. If that is not enough, then medical treatment should be started.
Okay. What treatment is the patient receiving, and how effective is it?
Well, most of our patients, hypertension behaves in very different ways in every patient. So most of our patients here in the hospital, they are in medical therapy, and some have issues with changing their lifestyle. They don't like to exercise, they don't like to eat well. So in those patients, it's harder to treat. You need a lot of medications just to achieve the goals in therapy.
Okay. What will happen if the patient doesn't get treated?
The disease will lead to multi-organ failure, and in the end, it will lead to death. If you don't treat this disease, it will kill you.
Okay. What new technologies exist for preventing, diagnosing, or treating this disease?
Well, taking into the fact that it's a very easy diagnosis, we don't need a lot of technologies to diagnose the disease. Although science has evolved in treatment goals, probably treatment of vascular renal failure, that's where science in this disease is advancing. But as in the terms of diagnose, well, it hasn't evolved a lot. It's very easy to diagnose. We don't need to evolve in that way.
Okay. Well, so these were all the questions. Thank you for your time.
Well, good luck.